Hi, I'm Dr. David Green, CEO of Preferred Pain Center here in Phoenix and Scottsdale, Arizona. Today I'm out at Papago Park, which is one of the Phoenix points of pride and is an extremely attractive park here in the center of Phoenix. We're actually in the amphitheater right now, which seats about 3,500 people and was built back in 1933 by the Civil Conservation Corps. The amphitheater used to be used for concerts, community events, Easter services at sunrise, sunset, but it's not used anymore about for the last 50 years. Why? Because of McDowell Road. It's a large thoroughfare from east to west, and that's when it was built, and because of that, this is sort of barren, except for people like me coming out shooting videos talking about why it's not used anymore. So the topic for today is spinal fusion. Does it work, and what are the issues surrounding the procedure? Well, spinal fusion since the year 2000 has gone through an exponential increase in its utility. Between 2002 and 2007, there was a 15-fold increase in spinal fusions. The question is, why? Right now, there's around 400,000 to 500,000 spinal fusions performed in this country every year. The indications for spinal fusion are all over the board. You know, for trauma, you have maybe some instability, or there's been a fracture and it needs to be corrected. You know, that's not really what the purpose of this video is talking about. Scoliosis, that's not really what the purpose of this video is about. We're talking about things like degenerative disc disease, which involves maybe a 1-level fusion or a 2-level fusion, or degenerative spondylolisthesis, which is due to usually degenerative arthritis, slipping of one vertebrae on another a little bit. There are other reasons for spondylolisthesis. I'm just talking about the one with kind of aging and arthritis. So, you know, there have been studies looking at fusions for degenerative disc disease and degenerative spondylolisthesis, and essentially what they have shown is between a 50 and an 80% success rate. Some studies show closer to, you know, the roll of the dice, and others show better. And some of that has to do with patient selection, and they found recently that it might have to do with who's doing the study. For instance, of those 500,000 spinal fusions done each year, 25% of them involved a product called Infuse, which is made by Medtronic. There was a recent Wall Street Journal article looking at the studies that were done for the approval of Infuse, and some of the surgeons who now receive royalties on the product and a lot of money for the studies didn't include all the data. So there were multiple adverse effects that were just kind of left out. So, you know, is there some ethical issues there? That's being investigated. They actually turned it over to Yale University to go back through all the results and objectively find out what was left out and would it change the results. So that is a big issue. 25% of those surgeries, now you have an issue with potential, you know, falsified study results. So with regards to does spinal fusion work, more of a 30,000-foot view, yes, it does for a lot of indications. It can change a person's life. It can get them back to working, functioning, playing with their children, better pain relief. It really can. But we need more research to look and see whether or not the indications could be tightened up. For instance, with degenerative disc disease, if you have a dark disc, a black disc, degenerative disc on an MRI, and you have a discogram procedure that shows it's positive for that, we have outcomes that show sometimes it works really well and other outcomes that show it doesn't. We just need better studies. That's the problem. So for right now, spinal fusion is continuing to rise in popularity. The question is why? Is there secondary gain on the part of the people doing the surgery? Is it truly because we have baby boomers that are getting older? And in reality, it's probably a combination. So it does work in specific instances. We need to ferret out the ones where it doesn't, and which, you know, consumers, people who are considering spinal fusion procedure, really need to look at the outcomes for their specific indication, whether it's instability or not. And I'll finish with one last thing. Degenerative spondylolisthesis in older individuals, you know, 60s, 70s, 80s, and I don't mean that to define older, I'm just saying degenerative disc disease is more like 30s and 40s. What you can see is outcomes that show that if you didn't use any screws and rods, you just put some bone graft down, the results tend to be equivalent to the screws and rods. So it brings the cost way down. The fusion can still happen, or maybe partial fusion, and patients have gotten equivalent results. So it is not clear-cut that spinal fusion is absolutely necessary in those circumstances, and even if it is, do you need screws and rods or just bone graft? So there you go. Anyway, to try and avoid spinal fusion, that's what Preferred Pain Center is all about. We have multiple options to do that. Check us out on the web at preferredpaincenter.com. We have a very active blog, lots of animated videos and educational materials. First time patients coming in get a free massage, and we'll get you in within 24 hours. That's our 24-hour guarantee. I'm Dr. David Green, Preferred Pain Center. Your pain stops here.